I have walked so many paths in my last 55 years. My journey, it has been all about my strength, teaching, and companionship. To my fellows, I have been more than a comrade. I have been a good friend, sharing joys and sorrows with them. For years, I have lived a peaceful life, somewhat away from my family, yet not alone. I am Sanam. My days were filled with vibrant colors of growth and learning. It was a life of fulfillment, of serene rhythms and unspoken harmonies. But as with all these stories, there came an unexpected chapter. Oh, it's so unbelievable. Why is this happening now? Who is coming there at this time?
Hi Sanam, hope you are doing well. I just came here to give you this Easter present.
Please.
You look so sad. Are you alright?
Yeah, Prakash, come in, please.
Okay. Are you okay, Sanam? What happened to you?
Oh, it's just a little back pain, Prakash.
But your face doesn't look like it's a little back pain. Let me call Dr. Lewis for you, Sanam.
No, I don't want to trouble you, Prakash. It's probably a strain. It will pass.
You are not troubling anyone, Sanam. You want help, and it's okay to ask for it. Remember, you help every others, and now it's time for others to help you.
Oh, thank you so much, Prakash. I don't know what I would do without a neighbor like you.
That's what neighbor are for. Now let's get you comfortable and call Dr. Lewis. Hi, Dr. Lewis. I'm calling you on behalf of your previous patient, Mrs. Sanam. She doesn't seem alright right now. She's having some kind of back pain. Can you assist her and help her?
Hi Prakash, don't worry, I'll talk to her. Can you please pass the phone?
Yeah, doctor.
Good afternoon, Sanam. Prakash told me you are having some severe back pain. Can you describe the pain for me, please?
Good afternoon, Dr. Lewis. It's quite sharp and it seems to be centered in my back. It started in this morning.
Oh, it's okay, Sanam. Let me start a comprehensive PQRST pain assessment for you. P stands for provocation. I'll start with P. What makes the pain worse? What makes the pain better? Can you describe any activities that seems to increase your pain? Have you found anything that provides relief, even temporarily?
The pain seems to increase when I eat, especially it's a larger meal. And resting and leaning forward sometimes removes and gives me relief, pain a bit, but it's just temporary, doctor. And uh, whenever I have pain, I take brufen. And doctor, even walking around in home, the pain increases and it's so hard.
Next, we will go for Q. Q stands for quality. What does the pain feel like? You mentioned the pain as being sharp and shooting. Can you describe any other sensation associated with your pain, such as burning, throbbing, or aching?
It's predominantly sharp and shooting pain that started in my abdomen and shoots in my back. It's like a knife that twists every now and then, but there's always this constant dull ache that never really goes away, sitting in the background.
we will go to next step. R stands for region. Where is the pain located? Does it spread to other areas? You have said the pain radiate to your back. Could you please point to where it starts and where it spreads?
Initially, the pain was in abdomen, but it has spread to my back, and now, doctor, I can show you. Usually, the pain starts in my abdomen. You see, it starts from the left side of my abdomen and it's spread along the lateral side of my body, and it goes in my back side. Doctor, it is very shooting pain, and sometimes there is burning sensation that accompanies the shooting pain, making it feel even more intense, Dr. Lewis.
Sanam, we will go for next assessment. Yes, severity. How severe is the pain on a scale from 0 to 10? With 10 being the worst pain imaginable.
Doctor, I would give 8 out of 10.
Okay. Has it reached this level before, or is this a new peak in intensity? How does the pain affect your ability to function?
I have had painful episodes before, but this time the pain is very intense than usual. And before, the pain was manageable with the over-the-counter drug because I took Brufen before. But this time, it seems to be very soothing and it doesn't work for me, doctor. It's significantly impacted my daily life. I find it hard to do basic activities around the house or even enjoy meals. It's exhausting both physically and mentally.
Next assessment. T stands for timing. When did the pain starts? How long does it last? Is it constant or intermittent?
The pain started a few months ago, but it was much milder back then, and I didn't think much of it. Initially, it would come and go, and I would feel it for a short while, and maybe for an hour and or so, and then it would fade. However, over the last few weeks, it became much more persistent and severe. Doctor, it's not just a brief discomfort anymore. It has become so constant and part of my daily life.
A few moments later.
Based on our conversation, it sounds like you are experiencing significant pain related to your pancreatic cancer, which peaks at an 8 out of 10 in intensity. This pain is sharp and shooting in nature, primarily affecting your abdominal area and radiating to your back. It seems to somewhat intermittent, but has a profound impact on your daily activities and your ability to remain independent. Since your Brufen is no longer effective in managing your pain, I can prescribe a strong analgesic for short-term relief of severe episode. You can make use of it. Also consult with dietitian to develop a meal plan that is easier on the pancreas, focusing on smaller, more frequent meals that is low in fat. And I am suggesting you physical therapy like yoga to improve your core strength and flexibility, which may reduce the strain on back and help manage pain. You can also do deep breathing exercise, meditation for reducing your anxiety. It is important to follow the plan closely and communicate with us about how you are feeling. We will adjust the plan as needed based on your feedback and any changes in your condition. Remember, our goal is to engage your pain effectively while maintaining your quality of life, independence as much as possible.
Thank you, Dr. Lewis, for putting such a thoughtful plan for me. And this time I know there is multiple approaches we can try, and I'm very hopeful that new medication will make a difference, and I'm also very intrigued by non-pharmacological strategies such as mindfulness, and I will definitely keep you updated on how things are going on, and make sure to attend all the follow-up appointments. And it's a relief to know we can adjust the plan as we go along, and I just want to find some way to get back to doing more things that I love to do, and even if it's in a limited capacity. Thank you, Dr. Lewis, once again.
Thank you, Sanam. Take care. Bye.
Looking back at the journey I have been through with my pain experience and pain management, I have been amazed by the progress that I have made. It was a challenging path with ups and downs, but the comprehensive plan that we have put in the place has made a difference. I am grateful for the support and guidance from my healthcare team and the unwavering support from my friends and my neighbors. This experience has taught me the importance of holistic approach to health, the value of persistence, and the strength that comes from vulnerability. This chapter in my life has shown me the resilience I possess, and I'm ready to embrace what comes next with